afternoon. Thank you for staying back to this last part of the symposium. Okay, bipolar disorder is a chronic relapsing illness. And so in the treatment of this condition, as with all chronic relapsing disorders, we hope that they will have less relapses and hopefully also we can reduce the complications that arise. All right, so under the CDMP, clinical monitoring becomes very important to achieve this outcome. Okay, the goals of clinical monitoring are these three. Firstly, we want to determine the patient's current clinical status and the response to treatment. The second part is that we want to track the medication use and the adverse effects. And lastly, we want to ensure that the patients receive quality and safe care. So if you're the doctor who's taken on a patient with bipolar disorder and following up the patient, these are the things that you want to look for specifically when you follow up this patient. Firstly, you want to monitor the current mood state and associated symptoms. 2, the stressors and medical problems. 3, current treatments. 4, the mental status. 5, laboratory data. And 6, the current clinical status. For the current mood state and associated symptoms, we go through the mood symptoms, which have been elaborated by earlier speakers, the depression, mania, and associated symptoms, especially that of anxiety, which we find that many bipolar patients may experience. And also, the previous speaker talked about suicidality. And then one area I find that is very important to monitor is the quality of sleep that patients have. Okay, secondly, we want to know the psychosocial aspects of the patient, especially in the areas of stress and medical problems. So if there are new stresses of life events, even happy events, for example, there be a marriage in the family or a birth within a family, these things may trigger relapses. If there are significant lifestyle changes, it may affect the biological rhythm of the patients and also make them more prone to relapse. Okay, if, for example, patients may enter university and then they might find that they have no time to sleep because of the increased study load, the projects and so on. These actually are important. Some patients use alcohol and substances. This is one thing that you need to exclude. And if medical illnesses or exacerbations happen, they also increase the stress level of patients. What we need to also to record is that what kind of additional psychiatric or general medical treatment operations or ER consultations or hospitalizations that may have occurred between the last visit and the current visit. Okay, moving on to current treatments. In your medical records, we should have indication of what medications are being used at the time, whether patients had missed dosages, are they adherent to treatment, are any other medications given on a PRN when needed basis, were there any adverse effects from any of the medications. Okay, and sometimes patients may be hospitalized and you have received ECT, and that should be taken note of. And sometimes patients also may be receiving psychotherapy or occupational therapy alongside the biological therapy. Okay, so mental status goes hand in hand with history taking. So besides the mood and effect, we also want to look out, especially in the depressive phase, patients who have psychotic symptoms such as paranoid ideation, ideas of reference, and some patients who are depressed or anxious may have obsessional and compulsive symptoms. Okay, this is the part that is sometimes very difficult, but yet it is one of the most important part of the monitoring. As you know, the mainstay of treatment in bipolar disorder is still biological, that is the use of medication. So because these medications are used for long periods of time, we need to make sure that we monitor them carefully so that they do not have adverse effects. So lab results are always done, and then we need to record the date and result of the most recent lab results. It is often useful to keep a chart of all your laboratory findings over the period of time, whether they're done 6 monthly or yearly. You should actually record them down, preferably in a place where you can find it easily. And if the results are obtained outside the steady state or at peak, you should be aware of that. There are various monitoring protocols for safety measures. They're included in our guidelines under Annex B. Okay, for example, for lithium, anticonvulsants, and atypical antipsychotics. So if you are actually taking on a patient for bipolar disorder under the CDMP, you should be familiar with these safety monitoring. Especially we want to monitor for metabolic disease, which is very common in psychiatric patients, whether or not they are on treatment. Okay, the prevalence of metabolic syndrome definitely is increased in patients with bipolar disorder. And metabolic syndrome is associated with increased morbidity and mortality. And the use of atypicals can lead to changes in metabolic parameters. So prior to treatment, we should have a baseline. And in this baseline, we obtain the patient's personal and family history of obesity, diabetes, dyslipidemia, hypertension, and cardiovascular disease. During each review, we perform a clinical assessment of clinical risk factors, for example, obesity, smoking, and alcohol. Measurements are also done at regular planned intervals. Height, weight, BMI, blood pressure, fasting glucose, and lipid profile. And lastly, we want to make a note of the current clinical status using the CGI, which is the Clinical Global Impression. Okay, the CGI is actually a very simple instrument to use, and I think it's been chosen because of its simplicity. Okay, it's sometimes used in research trials, but very often it is used also during hospital admissions. What the CGI does is to rate the patient's clinical status at the time of assessment relative to the clinician's past experience with other patients with the same diagnosis. So you don't really have to have guidelines as to what 1, 2, or 3 rating means. But just have to be aware that that based on your previous experience, where does this patient stand? Okay, and there are 2 scales. One is severity of illness scale, and the other one is improvement scale. You should take note of the phase of treatment, whether it's an acute episode or you're in the continuation or maintenance phase of the treatment. So this example of the CGI, the severity scale 1 to 7, 1 would be normal, not at all ill, to number 7, which is amongst the most severely ill. And again, the CGI-I, which is the CGI improvement scale, from 1 is very much improved to 7, very much worse. Okay. So this is the last slide. I think we have come a very long way in the knowledge and in of bipolar disorder, what it's all about, as well as the types of the armament of treatment that we have. So I think with improved education and improved effort in monitoring our patients, outcome of patients right now in this decade for chronic mental illnesses actually is pretty good. So I encourage you when you have patients with bipolar disorder, to follow the clinical monitoring carefully, so that together patient and you can reach a good outcome. Thank you.